and welcome to Population Health Plug-in, a show highlighting current public health issues in our community and topics of interest to students across the university. My name is Mina Nabavi, and I'm a program manager in the Office of Public Health Practice at the University of Alabama at Birmingham School of Public Health. Today, I am very excited to be joined by Aaron Royer. So Aaron is from a small town outside of Dothan, Alabama called Midland City. And he actually told me he just recently graduated this past Saturday, so congratulations to Aaron. When he came to UAB, he said he was originally pursuing a degree in biomedical sciences, but switched to public health and has loved it ever since. So thank you so much for being here today, coming out here in the rainy weather to talk about your internship experience this summer.
Thank you for having me on.
So I gave the listeners a little bit of a bio. Can you tell me a little bit more about yourself?
I'm from Dale County, Alabama, a small town outside of Dothan. I've always wanted to come to UAB since I was a kid. My mom talked to me about it a lot. I spent a lot of time there at the Children's Hospital. Graduated high school. I started working for the football team before I even started coming to school here. I decided I needed a job first, and then applied, got here, and here we are.
Okay, and so in the intro, you started out in biomedical sciences, but switched. So why did you switch to public health? What made you choose public health as your major?
Originally, I was interested in prosthetics, and then I got to UAB, and I realized that's going to be a lot of engineering, something that I didn't want to pull my hair out the whole time with. So I switched to public health, and I figured out that it was a lot of communication with people and just working with others. So I thought that was a great place for me to go. So I just went with it.
So this summer you completed your internship with the Coosa Riverkeeper.
Yes.
For our listeners who aren't familiar with them, can you tell me a little bit about them? What's their mission? What do they do?
So Coosa Riverkeeper is part of the Water Keeping Alliance, which is around 300 different organizations worldwide to make sure that the watershed is kept clean in their areas. We actually have 7 in Alabama, but the one that geographically is located mostly around Birmingham would be, I would say, the Coosa Riverkeeper, and they go over 230 miles of running water. Their main mission is swim guide and fish guide, and so swim guide is to check the chemicals in the water and make sure there's no like E. coli or something like that. And then the fish guide is mostly directly towards fish and how people eat those fish. So you don't want to eat, fish that are too highly contaminated with pesticides, chemicals, mercury, stuff like that.
And you were telling me before we started recording that you were actually introduced to the Coosa Riverkeeper through a course. Is that right?
I think it was a $3.99 course, Soil, Air, and Water, and it was a service learning project. And I actually just enjoyed working with them, so I asked them after the class, after the semester I've ended, asked them if they needed help, and they said, apply with an internship, and we'll use you.
Okay, so that gets right into my next question about your internship. What did you do?
So in the service learning project, we did a lot of paperwork, and it was mostly just research about laws and stuff that pertained to that, dealing with water conservation in Alabama, which surprisingly we don't have a lot of laws protecting Alabama's waters, which is of concern. A lot of plants do just freely dump in the water, and they really have no one to say, hey, don't do that. So that's where the Coosa River keepers step in and say, this is our water. This is for the community, the people. And that's where they really stick their neck out and make sure to protect the watershed. I would say what I did mainly in the first half of working with them was just, again, research. And then after that, we started actually going out and mounting signs. So that means going to physical locations, mostly areas that were highly traversed by fishers and boatsmen, and we would go out there and drill signs and mount them. And the sign has a link to an Alabama government website that tells them all the fish in that area that are contaminated and that they should avoid, and then fish that are safe to eat.
So that was part of the internship, not the service learning component.
Right.
Okay, gotcha. What would you say were some of the challenges that you experienced through this internship?
I would say one of the biggest problems is it kind of boils down to a bureaucracy aspect, just waiting for people to come back and hear from them. So Government officials and private landowners, sometimes it could take a few months before you got an answer back before, hey, you can come out here and plant this sign on our land to let people know. So that was the big issue, was just hearing back from people. But after we got that, we were able to plan up to, I think, 6 signs over my internship. I do plan on working with them more to continue placing signs. And I think we have right now 47 signs registered to be placed all throughout Alabama.
Okay.
So that's a huge number.
Yes, absolutely. Well, and I kind of switched the questions. I asked the challenges first before I asked the successes. So, but you kind of touched on that y'all were able to put out 6 signs. Is that what you said?
Yes. 6 signs over, I think it was like 125 to 150 mile radius.
Great.
That covers Coosa and a lot of high traffic areas, which was nice.
Okay, excellent. My next question was about plans to work with them in the future, which you which you kind of already touched on. Will you be traveling across the state of Alabama to get those 40 some odd signs up? Is that the plan?
So our plan, we have the 6 other Coosa, or it's not Coosa Riverkeeper, but it's Water Alliance members as well with us, and we have like the Black Cahaba River, we have a Mobile Baykeeper, and we have a few others. My goal right now is to make the signage prep kits, so that means getting the post, the signs themselves, the tools needed, and the screws and bolts and all that kind of stuff, the hardware that is needed for them to place the signs. I plan on getting all those ready and then sending them out to those water alliances for them to be able to do it themselves. But for the areas around Dothan, Ozark, Houston County, and again, Jefferson County, I'll probably be the one to do all the signage.
Exciting.
Yeah.
Anything else that you want to share about your internship that I haven't asked about?
I would say if you have an option for an internship, do it.
That was my last question. That's okay. Any advice to students who are thinking about completing the internship? Because you said it's, as of right now, the internship is not required for the undergraduate degree in public health, but
Correct.
You chose to.
Yes.
So you're encouraging those, if they have the option, to do it. Mm-hmm. Why?
Originally, I did it because I did not want to take, I think it was the next stage chemistry. I can't even remember what that is, honestly. But I didn't want to do it, and I needed the credit hours. So that's one thing, is that internships do offer credit hours, but they can also, be put on transcripts and also turn into a job, which is hopefully what I'm working towards right now. But I would say if you have an internship, take it because, 1, you don't know where it's going to go, and 2, you don't know when the option is going to present itself again. One thing I would say, and I would say a lot of people have learned this as well, is that COVID really can change the way that you may have had a goal set or a plan set, but then COVID happens or life just happens and that changes. And I would say you don't know if that's going to present itself again. So really take it.
Absolutely. An opportunity for you to gain hands-on public health experience, right?
That too.
Which, since you just graduated, are looking for a job, those skill sets are so important on your resume. So
yes.
I've got to say, in the time of COVID, I guess you spent most of your time outside. Is that correct?
Yes. I would say about half and half.
Okay.
Which was nice.
Okay. Even in the Alabama summer heat, I guess. Well, I think those were all of the questions that I had for today. I want to thank you for being here and sharing your internship experience with me and our listeners.
Awesome. Thank you for having me.
And thank you to our listeners. Please tune in next time for another episode of Population Health Plug-in.